According to the Centers for Disease Control and Prevention, approximately 1 in 68 American children have been identified with autism spectrum disorder. With the increasing number of children being identified with autism, there's an ever-increasing demand for more board-certified behavioral analysts. In 2013, the University of Texas at San Antonio's College of Education and Human Development established the Teacher Education Autism Model, or TEAM Center, to serve the community and address this need.
The center here is the Teacher Education Autism Model, or TEAM Center for short. And it's designed to function as a teaching hospital for introducing our graduate level students and as well as undergraduate students into effective teaching practices to get their hands on a child with autism and use the latest evidence-based practices to effectively promote verbal behavior and reduce problem behavior for the children we serve. We assign them in a 2-to-1 setting as 2 therapists for every 1 child. Therapists are graduate students that are seeking certification to become board-certified behavior analysts. And this is a way for them to really take what they're learning in the classroom and get some hands-on applied experience.
Dr. Mason's very great about having an open door policy, so you can come and observe and kind of see what being a behavioral therapist is all about, which is really nice to someone who has no experience with working with children with disabilities or even really knows what it is. You learn how effective ABA therapy can be to these children, and you get to see it firsthand.
The TEAM Center also conducts valuable research to help determine effective teaching practices, such as the referent-based instruction or RBI model.
It's based on other natural environment training programs for children with autism. We identify what's stimulating the student at that point, and we capitalize on that stimulation. So whether it's they're playing with a ball, whether it's they're doing some type of motor activity, swinging, jumping, things like that, we want to build a language program about what that kid's engaged in. So if they're playing with the ball, we teach across the various we call verbal operants about how they can talk about that ball. So one way is to request the ball, being able to say the name of the ball. Another is to look at the ball and be able to identify it, have the source of the ball be a source of control over the student's language. When other people say the ball, we want the kid to be able to reply back and talk about the ball in kind of in a co-eg sense. And then in kind of a larger conversational sense, when we're talking about things that roll or things that bounce, that child should be able to say, oh, a ball's bouncing.
The UTSA TEAM Center is providing care that's not always readily available to families in and around San Antonio.
Providing that direct service to the community is really what keeps us here on a daily basis. And getting a chance to work with the kids and really make a difference in those kids' lives is certainly kind of the immediate reinforcement we receive for that. Beyond that, we want to see our students really develop new skills and develop behavior analytic techniques and learn all the skills that they're going to need to be successful once they leave the classroom here at UTSA and go out into the field. And then really long term, we are also that research site, so we're looking to further the knowledge base on evidence-based practices for kids with autism.